Thank you very much, Dolly Count-Gottlieb, for this third roundtable. Let's conclude this forum. And I will ask, first of all, Andrea WINKLER from the Lancet One Health Commission.
Well, thank you very much for your introductory words, and it's really a pleasure and an honor at the same time to now present our joint recommendation from Table 1, which I will remind you was caring for EU citizens and their shared environment. So basically, I'm the rapporteur, and this is the recommendation that we have pulled together, all together. The first box is about governance. So we recommend affirm the European Union's explicit competence to take global responsibilities and action on health policy. Act at all levels of society to counteract increasing fragmentation that left so many people vulnerable. I think these are all buzzwords that are actually going throughout the three roundtables, but I think we cannot repeat them often enough. A strengthened coordinating mechanism with solidarity and equity principles, Ole Petter, these were your words as well, between member states. Develop strong, equitable, and when we say equitable, because our roundtable was very disease-orientated, we mean infectious diseases, but also non-communicable diseases, and not to forget, of course, rare diseases, and innovative health systems based on interdisciplinary, intersectoral, and cross-country collaboration, and at the same time implementing the principles of universal health coverage. I didn't really hear this today, but it's a very, very important approach and construct that we need to implement. Then increase investment, public and private, and also through philanthropies. It was very interesting to listen to Isabel, and in prevention and management of infectious, non-communicable and rare diseases and their comorbidities and resulting disabilities. Box number 2, crisis management. Sorry, if you go back to the first slide, it's just the box number 2. Yes, thank you. Recognize the connection, now this is Laura, between climate change, air pollution and health from a holistic perspective, including infectious and non-communicable diseases which require immediate and transformative actions at all levels. We want to optimize investment in prevention of health threats, preparedness and response, especially for the performance of the European Health Emergency Preparedness and Response Authority here. And we have heard this from various speakers, not only from the first roundtable. Then support the establishment of a global WHO convention, agreement, or other international instrument. They have not decided yet how they're going to call it, on pandemic prevention, preparedness, response, with an integrated One Health approach. Next slide, please. Trying to speed up. Then we had another block, which was digitalization and data. Develop more robust national surveillance and reporting mechanisms for infectious and non-communicable diseases, again, taking into account the One Health approach. Counter the threat from fake news by furthering inter- and transdisciplinary research, again, research, science-based, evidence-based, and to strengthen communication mechanisms for rapid generation, translation, and sharing of science-based evidence. Harmonize disease management and vaccination protocols, define common minimum standards for interoperability of data systems, for example, the European Health Data Hub. I'm not reading out everything now. I'm very conscious of time. The last block is actually sorry, if you go back again, thank you. It's about manufacturing, logistics, and health systems. So we recommend to strengthen the EU's global role in the regulation and distribution of medical and pharmaceutical products to ensure that such products are readily available, and to improve the global supply chains, production capacity, and stockpiling with specific mechanisms to procure adequate supplies in emergencies and beyond, not just emergencies, but we put it there. Then last but not least, to scale up investment in infrastructure, so health system, infrastructure and healthcare workforce to make health systems more resilient, health in all policies, leave no one behind, as again, buzz sentences or keywords in the face of changing health needs and future health threats. And please, now my last slide, I only would like to remind us, thank you, that we have talked a lot about evidence-based research, about science-driven data, and about One Health. We do have a One Health Commission that is exactly doing this. It's called the Lancet One Health Commission, and it's generating the much needed evidence. It's led by the University of Oslo together with partners from Ghana, Kumasi, and the Technical University of Germany, where we are from. And I just also would like to take up our student and young generation voices. And you can see in the wheel on the right side, where we put human health, animal health, and environmental health at the same level. We look at infectious diseases, non-communicable diseases, and antimicrobial resistance. We do the same for food system. So safe food and food system, that was Francesco. Climate change is part, biodiversity loss. And then we have the outer circle where we have all the cross-cutting issues like governance, but which also includes, of course, good leadership, policy generation, then economics, finances, knowledge sharing, and not the least engagement of communities and the most vulnerable people. And that will lead to our recommendations. We are at the moment in the pre-final stages of the draft. I'm the co-chair together with Dr. John Amwesi from Ghana, and we hope that we can deliver the report this year and that this will be also useful to the EU, to a potential EU health union. Thank you very much.
Thank you, Andrea. Sans transition, nous passons à Tarita BALDAN.
Thank you, Andrea. Let's move on to Tarita BALDAN, who will summarize roundtable number 2.
Thank you. My name is Tarita BALDAN, and I work at Global Health Advocates, which is a French NGO that advocates for policies and resources that effectively address health inequalities. Thank you for organizing this event and for the speakers for all the great recommendations. As we heard in Roundtable 2, Embracing Global Health Responsibilities, the EU has been a key player for global health. More recently, it supported the launch of the ACT Accelerated, called for international response to COVID pandemic, and co-hosted the Global Health Summit, where the Rome Declaration was adopted. And while the EU is eager to build greater health security for European citizens, it should not allow protectionism and strategic autonomy to steer its global health agenda. Instead, it should aim to provide everyone the right to health. A quick question is, how can the EU support when global health systems is controlled by corporate interests? EU leaders should stop defending rules that directly prevent the world from meeting its global health needs for everyone and lay down obligations that run against global health goals, like equal access to basic health services, treatments, and vaccines. For example, today, 45% of Europeans have received a third dose of vaccination, but only 11% of the African population is fully vaccinated. So how can the EU concretely meet its commitment and take global responsibilities in global health? First, the EU should be a strong multilateral partner that speaks with a common voice, truly guided by global solidarity. The COVID pandemic has shown that global crises need global responses. To end the COVID pandemic now and ensure better preparedness and response to future health threats, the EU should, 1, adopt a new global health strategy. The current framework, as speaker said, for global health dates back to 2010, long before the establishment of Sustainable Development Goals, the new consensus on development, and pressing issues like COVID, Ebola, and ARM. A new strategy should establish global health as a key priority in line with One Sustainable Health approach. It should guide cross-sectorial implementation of the EU consensus and ensure coherence across different EU directorates and with its member states. The EU has increasingly used the Team Europe brand for its joint actions, but without a clear and comprehensive strategy for global health, Team Europe will continue to be fractured and incoherent. 2, it strengthens its political and financial commitments to international mechanisms. The EU must meet its fair share for financial support to the ACT-A and contribute financially to meet the 2022 targets. The EU must also continue to mobilize financial resources to strengthen the health system, contributing to universal healthcare, ensuring resilience to address existing and future pandemics. This can be done through financing effective partnership already in place, such as the WHO, Gavi, and the Global Fund. To do this, the EU will likely have to dip into the flexibility instrument of its new budget, since the existing funding for global health is insufficient to meet the needs. And three, as Simon Kabura pointed out, support the temporary waiver of IP rights and technology transfer. Support for international mechanism is not enough to address bottlenecks preventing global distribution of vaccines. More than 160 countries have supported the TRIP waiver. The EU continued to block it. The EU must stop blocking the TRIP waiver at the WTO and commit to reinforce COVID technology access pool and as well as biomedical production capacities in low-mid countries to make technology a reality now. Secondly, the EU should reinforce its leading role in research efforts. The pandemic has exposed critical gaps in the global research and innovation ecosystem and reminded us how damaging it can be to lose sight of public interest and the principles of equity while dealing with health emergencies. To secure equitable and affordable access to medical countermeasures, the EU should first maximize societal impact of EU research and innovation funding. Medical tools resulting from public funding need to be considered as a public good and therefore be subject to conditions of affordability, access to results, open data requirements, and intellectual property management under fair conditions. To the new European Health Emergency and Preparedness and Response Authority must ensure coordination and collaboration with other agencies and global health actors to increase efficiency and avoid duplication of resources. It should adopt transparency practices at all levels. The EU knows perfectly what it needs to do to end the pandemic and ensure equitable access to healthcare worldwide. NGOs and communities have been repeating these recommendations for years. Whether the EU commits to serving public or private interest will determine the way forward. This is truly a political will. Thank you.
Thank you, Tarita. Et nous entendons maintenant Matthias WISMAR de l'Observatoire européen des systèmes et des politiques de santé pour un résumé des recommandations de la table ronde numéro 3.
WISMAR for the
Thank you so much.
Last one.
Thank you so much. What an afternoon and what a great roundtable, actually. I think it has become crystal clear that we cannot move on like this. We need to change. We can no longer afford to be reactive. We need to be much more ambitious. And we heard from our roundtable, actually, that we need to be very ambitious with regards to innovation. We are falling back. We need to strengthen innovation and the cross-border research systems that underpin the innovation, the data spaces that underpin it, the quality of the data that underpin all this. We've heard about the health workforce, how important it is that the health workforce is working in teams, in networks, multidisciplinary teams. We heard about the needs for training, education, and upskilling. And we heard throughout the day, actually, the need to improve our crisis response and to be better prepared. And the red thread going through all the presentations today at this roundtable was the governance. And rightly so, because the governance is the single most important lever for change. We can mobilize with the governance science, health workforce, money, models of care, whatever. And haven't we seen throughout the pandemic a lot of very important examples? And I start with what Gunhild was saying, actually. She was talking about the leadership, and throughout the pandemic we have seen the best and the worst. We have seen great governance and we have seen failure of governance, and I think that we need to work on all levels of government to improve the governance here. We've heard from our participants of the roundtable that stakeholder involvement is so important, both in terms of giving, information, helping policymakers, but also to make sure that ownership is there in implementation. And it was Freek who reminded us that stakeholder involvement in terms of just talking about the usual suspects and the social partners is not good enough. We also need to include those who have difficulties to stand up with their own voice, like the homeless were mentioned. And to do this, actually, probably we need to have another strong initiative to strengthen civil society involvement in health and health system on all levels, whether it is the European level or the local level. And just to say one more thing, these are all ambitions and we need to do this, but Dorley at the beginning of the roundtable actually said it also probably needs legal change. And the most substantial legal change for European Health Union would of course be an amendment to the treaty, a treaty change, but there are many other instruments, whether they are directives, regulations, or decisions that may need adjustment if we really want to succeed with establishing a European Health Union. Thank you so much.